Kelsey O'Brien. I'm a senior account manager here at Glooko, and I'm going to be walking you through our billing report today. So if you're familiar with using the Glooko web application, you're familiar with this screen. I'm on our View Patients tab, where we have broken out the patient population within our demo environment by last sync date. And I want to highlight this tag functionality for you briefly, because tags are a really great way to add details about your patient population so that you can filter within the billing report. So for example, if I click on this little square with a pencil in it, I can add RPM as a tag to this patient's account. So when I'm in our billing report, I can filter by that. You can create multiple tags for a patient. So you could have, doctor name, you could have clinic name, and an RPM care program if you want. And that way, when you're in this report, you can filter down to whatever level of detail you're looking for per patient. So for this example, I just want to add RPM. It's already there, but I just want to show you how easy it is to create. So you just do RPM, it'll pop up and you hit apply. Moving on to the billing report. I'm going to go to the upper right-hand corner where my username credentials are and click on Population Health. Once I'm in Population Health, I can go back to the upper right-hand corner and click Export User Data, where I will receive a pop-up having me select the date within the last 180 days to give it a time frame for which we want the data. So I do recommend a month. So we're going to look at March 1st through 31st, 22, and I'm going to hit Export. You'll notice it might take a second to populate the report. Be cautious to not click export again, or it will give you two pop-ups for the password. That's okay if it does, just make sure you copy the right password. So as you can see, this pop-up will give you the password for the CSV file at the bottom. So what you're going to want to do is copy that password, because that's your ticket into opening this file. Once it's open, I can open the file. I'm going to make this a little bit larger. I'm going to walk you through some of the most important columns in this report. So as you can see, we have the patient first and last name, date of birth, MRN. This is your entire patient population. And as you see in column H, we have Glooko tags, as I spoke about earlier. Column I says achieve 16 days of daily remote data and query range. And column J says date of 16th day of data, remote data. So there's a couple ways to approach this billing report. The first being you can easily filter by the Glooko tags, like I had said. So you could filter down to just the ones that you have tagged with RPM program or billing program, or by clinic, however you choose to set it up. It's also super easy to filter to just the ones that say true for achieve 16 days of daily remote data, because that's really what you're looking for to be able to bill, is that the patient uploaded 16 days of remote data. It's also important, it'll tell you this, the date of the time frame, the day of the month, if you will, that remote data was achieved. It'll tell you if they had an in-clinic upload during the range, the time range, meaning were they seen in clinic. It'll tell you the date of their first in-clinic upload. And then it'll tell you how many days of data they got from each of their perhaps various devices. So if they got them from an SMBG, a CGM, remote insulin, so on. And that's just important for audit purposes if you want to keep track of that information. So I do recommend using filters on this report, whether it be by tags or just filtering down to the patients that met the criteria of the 16 days, makes it a lot easier to look at. And then these are the patients you'll be billing for. I appreciate any feedback you have. Please share it with your Glooko account manager. Have a wonderful day.